Today, we're speaking with Dr. TERESA BERTSCH, Vice President of Medical Affairs at the NARBHA Institute and Chief Medical Officer at the Guidance Center in Flagstaff. Welcome to 10 with Palm, a series created to dialogue for 10 minutes with community leaders and those of influence throughout Arizona. While the COVID crisis continues to impact and disrupt much of the world, one could argue that it has disproportionately strained those working in the healthcare professions. These strains on medical professionals, their families, and the entire first responder community will likely have a lasting impact on the field of medicine for years to come. My name is Dan Palm, and our guest today is Dr. TERESA BERTSCH, Vice President for Medical Affairs at the NARBHA Institute and Chief Medical Officer at the Guidance Center. Dr. BERTSCH holds both an undergraduate and graduate degree from Stanford University, as well as a doctorate in medicine from Case Western Reserve School of Medicine, and is a board-certified psychiatrist. During our conversation, we discussed the global COVID crisis and the ongoing mental, intellectual, and moral strains that healthcare professionals are experiencing during this global pandemic. Great to have you here today on 10 with Palm, Dr. BERTSCH, speaking with us about important issues and this COVID crisis that we're facing. As we start, I'd like to help our viewers understand your leadership role and your as a healthcare professional in Northern Arizona. If you could share a little bit more about your role here.
I am the Vice President of Medical Affairs for the NARBHA Institute, which is a foundation located here in Flagstaff, Arizona. And as part of that role, I'm deployed over to the Guidance Center as the Chief Medical Officer, which is a role that I've been playing for the last 2 years. So as part of that, I've been responsible for overseeing the Guidance Center's pandemic response to COVID-19. In that role, then, I've been responsible for trying to figure out how do we keep our patients safe, how do we keep our staff safe, how do we respond to COVID-19, because this is such an unusual time in our history and in healthcare history, and we don't know how to manage this. You know, the pandemic happened just about, it was declared in the middle of March, and so it's been a real challenge to figure out how to take care of high-risk, vulnerable populations, such as the ones that we serve, without having adequate personal protective equipment, without having, initially in the whole COVID crisis, without having adequate testing, without having the knowledge about how to take care of people who are COVID positive. And I'm really proud to say that the Guidance Center was one of the first psychiatric hospitals to take care of people who are COVID positive.
Thank you for that explanation, and it sounds like there's a lot of different pieces here, a lot of moving parts, and different parts of the community that you're engaging with across the county and beyond. What's it like to be a healthcare professional on the front lines at this time?
Well, wow, you know, it was exhausting. It really was. And, you know, it has been humbling and challenging. For behavioral health, there were no guidelines for how to respond to a pandemic. And so when I was researching in order to put together the guidelines that the Guidance Center is working under, there was nothing out there. The responses that various different places had, like up in Washington, on the East Coast, in China, were really suboptimal. A lot of the responses were, you know, lock the front door, keep all the staff inside, keep all the patients inside, so that you create this potential barrier to COVID-19 coming in. But as a result of that, a lot of psychiatric providers and patients died, unfortunately, in those facilities. And so that was not the approach that we wanted to have. We really wanted to still be able to accept people and treat them. Our staff felt like they could die, that they could be exposed to something unknowingly and then bring it home and give it to their family.
What are some of the strains that healthcare workers are going through that you're seeing and that you're reading about in the research?
The way I've conceptualized it is that there are like three big areas where this has caused strains, which is going to cause, I think, mental health consequences to healthcare workers. There's intellectual strains, there are personal strains, and then there also are moral strains. So I talked a little bit about the intellectual strains. We have a worldwide lack of experience with this virus. And there's so much information that people had to consume initially through unestablished channels. So doctors were learning about how to manage this from other friends on Facebook, from email lists, not from peer-reviewed, accredited journals, training from mentors. You know, the medical model is see one, do one, teach one. There was nobody who was in the category of doing it and teaching it. We were all in the C1. And that is very hard on people on doctors, nurses, healthcare workers, who are used to having a mastery of a particular body of knowledge. I mean, there's so much specialization in medicine. A lot of that way that we coped with our own stress normally would be learn more. And that learning was just thwarted by a lack of information. There was also so many decisions to make that healthcare workers have a lot of decision fatigue, especially in the beginning when there were not guidelines. Every patient was like a brand new case, you know, and so you couldn't take those mental shortcuts like, okay, I know how to treat strep throat, you do ABC. You know, these are the tests you do, and then you give this medicine, and if after this amount of time it's not working, then you do this other thing. Well, all of those kind of processes were not in place for COVID-19, and so that made the actual work of being a healthcare worker even more tiresome. It made them people feel like they didn't know what they were doing. So that lack of mastery really wore people down and gave a lot of personal strain as well. Initially in the crisis, and you know, like I said, it can feel a long time ago, there was not adequate personal protective equipment. So like masks and N95s and shields and gowns and gloves, really basic things were not available to people. And so people felt helpless in the face of that. We also didn't have any tests available. And so we couldn't even say, who was it that was sick with this? And how do I then protect myself against that? People felt like there was no way out, that they had to go to work in order to take care of patients, and yet then they were bringing it home potentially to their family members. And so what do? Quit work? You know, healthcare workers were one of the essential worker fields, and so they were not able to opt out and get like family medical leave or be able to receive some of those benefits that maybe some of the other industries had. A lot of people were just avoiding their family. You know, doctors and nurses started sleeping in different rooms. Some, like in New York City, people started just getting hotel rooms, and the hospitals actually provided them with hotel rooms so that they wouldn't bring it home. And it also then caused a lot of staff shortages. So in addition to feeling vulnerable at work and feeling like maybe you could go home and get a refreshment, because of people getting sick, because of people having to take care of family members, and now, you know, being able to homeschool, there were a lot of staff shortages as well. And that is just really wearing on people. I think the other thing was that there was a big moral strain on healthcare workers. People felt like they were an imposter, like, I'm the doctor, I should know how to do this. And yet, I don't know how to do it. I don't know how to inform families about what is the most appropriate treatment for your loved one. And then the additional part of that is that we started restricting access for visitors to come into hospitals. And so people were dying by themselves and dying in rooms with everybody in the room completely garbed as if they are, you can't even see their faces, you can't read their expressions, you can't see that people are smiling at you. We had this thing like trying to teach all of our healthcare workers, crinkle your eyes, because your mask is covering like this. Make sure you crinkle your eyes so that people can tell that you're smiling at them. That's just such a different way of relating to people when you can't use facial expressions and you're completely covered. Our healthcare workers didn't want to get hospitalized and they didn't want to be part of that. And yet they had to do that. A lot of doctors were not used to having the volume of people dying. In our facilities here up in northern Arizona, the number of deaths that were happening in emergency rooms, that were happening in intensive care units, to people who you didn't feel like this was the time to go. They might have looked okay, and then all of a sudden they crashed. And that is, doctors and nurses are taught how to manage death and all the feelings associated with it. But this was different. This was a lot bigger. And added into that, I think, was moral injury, because we were having to witness things that we didn't think we should have been witnessing. That there should have been enough PPE for everybody. That our government in some way was not taking the steps necessary to protect both healthcare workers and protect the population. And those kinds of things can lead to a lot of mental health conditions that we're going to be seeing for a long time, I think.
Thank you, Dr. Bertschch, for speaking with us today. Stay tuned for part 2 of our conversation with Dr. Bertschch about the ongoing pandemic. If you've not yet followed the 10 with Palm Facebook page, I encourage you to do so. My name is Dan Palm. Stay tuned for more exciting episodes with community leaders and those of influence throughout Arizona.